So basically, I'm going to be talking about what is heart disease, what causes it, and why is it that people who look completely healthy, why do they run into trouble? And then we're going to talk about, is heart disease reversible? So what is heart disease? Let me hear some answers.
Plaque.
Plaque, okay, plaque in the arteries and vessels. Okay. What are some other?
Arterial fibrillation.
Okay, so abnormal rhythm in the heart.
Yeah.
Stress.
Stress. I think stress is maybe a cause of the disease. Any other answers for what is heart disease?
Broken heart.
Inflammation
It's
and
like tissue damage.
tissue damage, okay. Angina is the pain that you get, and that was one of my challenges, or my challenge now working in 10 states in emergency rooms. Someone comes in with chest pain, well, is it coming from the heart, or is it coming from something else? So, which one is the healthy one?
Maybe the one on the left.
Yeah, okay, good. So, and you see the one on the right is looks almost completely blocked. And as you'll see in a few minutes, this actually isn't the most dangerous one. This is the one that they might stent if it's in your heart. But a small plaque there might be more dangerous. We'll talk about that in a minute. So you heard from Brian that you've got 50,000 miles of blood vessels. That's over 2 times the circumference of the Earth. And when I saw this slide, this data, this really broke my heart. It fits in with exactly what Brian said, which is the deaths of in this country from heart disease is basically not heard of. It was never heard of until modern age, and it's not just this country. If you look around the world, it's basically the Western world, the Westernization, that's producing heart disease. So, next thing is, what causes heart disease? Let me hear some answers. Diet, that's part of it.
Lifestyle.
Exercise, stress, okay. All right, we have an Egg McMuffin here. Who had an Egg McMuffin for breakfast today? All right.
Don't think about that. Don't think about
Think
that.
about that. So this is an area, so there's a lot of misinformation about, oh, fat's really good for you. Well, not this type of fat. And this is a study that was done basically looking at the endothelial function. The endothelium is just the lining of the inside of the vessel. And what happens is when you eat a high-fat meal, this is what this study showed, your vessels basically clamp down. When you eat a high-fat meal, this is what this study showed, your vessels basically clamp down. So, and it's interesting, if you eat a low-fat meal, let's say you eat a high-sugar meal, nothing happens to your vessels. And the timing on this is almost immediate, and it lasts 4 to 6 hours. So if you think about what the typical person in this country eats, they're going to have a Egg McMuffin, and then boom, the arteries are going to clamp down, and then it's time for lunch. What's going to happen? Boom. And then what's going to happen again with dinner? And then, so that's on the short term, but then after years and years of doing it, then I guess as soon as you hit 10 years of age in this country, you start building this plaque. And some people kind of use this for fun. Has anyone been to this restaurant in Las Vegas called Heart Attack Grill?
Oh, we got nods. We got nods. Don't think about it.
And they make fun of it. They say, oh, well, if you only eat one of our hamburgers, that's a single bypass burger. And you can get the quarter bypass burger. And it's part of humor. And this is a really serious subject. But they use humor. They said, if you've eaten enough of this Western lifestyle that you've managed to increase your weight enough, we're going to give you a free burger if you can hit 350 pounds. So,
Where's that?
this is in Las Vegas.
I bet.
So anyone knows what these are? The crystals are actually cholesterol crystals. And so people say, oh, well, cholesterol is not dangerous. And it's true, there is cholesterol in every cell of your body. But it's not safe to eat the amount of cholesterol that people get in their diet. And this is the reason why. If you see, there's some really sharp spikes here. And that spike is actually what does the damage in your vessel walls. This shows the danger. So many people think, oh, I only need to worry about my vessels if they get completely blocked.
They're like completely blocked, right? They think that's the problem.
But that's not the dangerous thing, because as you heard from Brian, your body is smart enough to put in alternative pathways, recanalization, accessory pathways so the blood can flow around. The danger is if you have a 20-30% blockage in a plaque, that plaque can rupture. And if you can imagine those cholesterol crystals right there, and you saw how sharp they are, they can just start a bleed, and then boom, there's no blood flow going through. Now there's certain parts of your body where that's not as much of an issue, but if this is going to your heart muscle, or if this is going to a part of your brain that's sensitive, that's a big deal. So the way I think about it, going back to the analogy of how your vessels tighten every time you eat a fatty meal, it's the same as if you took a hammer and hit your toe, and hit your foot. So, and you know what, if you did that once, it would hurt. You might take a little Motrin or some Tylenol, and it would go away. But imagine doing this 3 times a day. That's what you end up doing to your vessel, and that's why you get all this accumulation. So, and people say, oh, I just have moderate health disease. Well, that's just like using a moderate hammer. So why do healthy people die suddenly of heart disease? I mean, this isn't a rare thing. This is actually, we were talking about this data this morning.
Yeah.
This is 25% of cases of heart attacks.
Right. So there's probably more, but there's at least 600,000 deaths a year. That's 1 every 40 seconds. And they say out of 300,000 sudden cardiac arrests, half of them, so 150,000, there's no signs to it prior. So 1 out of 4, deaths related to heart disease are sudden. No one even knows that they had heart disease.
So let me talk a little bit about Tim Russer, who was a TV broadcaster.
Oh, yeah.
Many of you remember him. And I remember him every time I see a patient in the emergency room with chest pain, because his story was he presented to the emergency room with chest pain and had the typical workup that we do in the emergency room and with his cardiologist with an EKG, and he ended up getting a stress test which looks for large blockages in the heart, and they said, don't worry, everything's okay. And it's true, the large, there was no large blockage. What ended up getting him was one of those small blockages, small ruptures, probably from the cholesterol needles that you see, and that's one of my biggest concerns when I see patients. They're coming to me in the emergency room. I can say, look, you're not having a heart attack right this second, but I can't tell you if this pain you're having isn't coming from your heart. All right, so next question, is heart disease reversible? What do people think? Yes. That's great. So we got a smart audience here. I think it's the best kept secret in medicine. And with my 2 degrees in biochemistry, I understand it now because, of course, our goal would be to create a medication, find one pathway, one magic drug to fix the problem. if you ever look at these biochemical pathways, I mean, we could fill all the walls in this room. And it's more complicated. That's why if we use the body to heal itself, we can actually fix things. So this is an example of reversing. This is a LAD coronary vessel, a heart vessel. This is before a plant-based diet, and this is after a plant-based diet. So the only way you would see something like this, well, actually, this is the only diet that I'm aware of that's been shown to reverse heart disease. So if you're talking to your friends or family and they say, well, I just read this book and it's a great diet, the one question to ask them is, has it been proven to reverse heart disease? And if they can't say yes, I wouldn't even consider it. And this just illustrates the whole food plant-based diet that we're talking about. And down here we have the Atkins, or what I like to call the Fatkins diet, which you get nice, lots of plaque here in the arteries.
Yeah, but in the beginning, when you do the diet, you don't get fat.
That's true. You may lose weight because you're not eating lots of processed foods, carbs, etc. But here's the thing: just because you're just because your weight's going down, doesn't mean the health of your vessels is improving. Every time you eat that fatty meal, you've got that hammer that's hitting your foot again.
Yeah.
So here's just a picture of me overweight, and this is me eating plants now. Yeah, 50 pounds lighter. So yeah. Besides eating a whole food plant-based diet, what are some smaller things that I can do to prevent heart disease? Here's a list I came up with is start by cutting out cheese and chicken. And the reason I mention these are the ones that have been shown to cause the most weight gain. We'll talk in a little bit about Cardio Miracle, which I love that product. And basically what Cardio Miracle is doing is, just as we talked about how when you have a meal of fat, it squeezes those vessels, Cardio Miracle, the nitric oxide, does the exact opposite and relaxes things for you. And basically what Cardio Miracle is doing is, just as we talked about how when you have a meal of fat, it squeezes those vessels, Cardio Miracle, the nitric oxide, does the exact opposite and relaxes things for you.